So this is the head to toe assessment. So usually I start off with these like so. When you walk into the patient's room, you want to knock, introduce yourself, do any hand hygiene, and so I usually always start by just first observing the patient, just noticing like their level of consciousness. Obviously, this is alert and oriented. Just look at their kind of look at their like mental ability. Just notice like do they walk in or just like how do they come into the room. You also just want to just kind of overall make note of like their like kind of emotional level, like are they angry, upset, or are they calm, cooperative. You can also just if they walked in, you can notice their gait, like do they how's their stability when walking, do they use an assistive device such as a walker or a cane. um, you can also always ask them just some questions just to see if how their level of alertness. So you ask them their name. So what's your name?
Caitlin.
Right. When's your birthday?
December 4th, 89.
Right. Ask them just if can you tell me where you're at?
I'm at home.
That's fine.
Or the ER. I'm at ER.
All right, and then just ask them. I usually always like to ask them just like what year it is.
2005. 25.
Are you sure?
It's 2025.
Okay, so say we're alert and oriented times 3, but so alert and oriented times 4. All right, and then also just throughout the whole head to toe exam, just always looking at their skin, just as you go through each different system, just go as you go from head down to toe, just always be looking at the skin just to notice for any changes in coloration, any like blemishes, maybe note any bruising, like kind of maybe want to ask them if they're like on any blood thinners. So first, just gonna start. So we're gonna start up top. So just looking at the hair, just want to note just kind of the condition of their hair. Note if there's any like any maybe areas that like are balding, could be signs of alopecia. Of course, want to see if there's any infestation. Notice if there's any lice or bed bugs. Hopefully not. Also, just note like maybe the oiliness. Just kind of can give you an idea of the overall, just like kind of maybe their hygiene. So then you can just kind of with gloves on, you can just kind of palpate the head, kind of just note, making sure the head's like normal cephalic like shape. Notice any like indentations or any nodules, lumps, or masses. So, and then, one thing I did forget to mention, like also before you do start the assessment, you could also just get a full set of vitals. Like usually first thing you do in the ER I do is just hook them up on monitors just to get pulse, blood pressure, get their oxygen levels. Okay. Then, so moving down, kind of just moving down to the face. So you can just use a ophthalmoscope. Okay. You can just look at the eyes. So sorry. So just want to first you're gonna note like that, or let me get my pen light. So I'm just gonna look at the eyes. So I'm just looking for perla. So pupils are equal, reactive, round, and accommodating delight. So I'm just testing that tests the oculomotor, cranial nerve, Also could do have them do a Snellen chart, just stand 20 feet away from it and see what the furthest down line they could read. It's for the optic cranial nerve. And then you can just to get rid of, just do one of the other cranial nerves, just have them focus on an object that is far away, and then have another object, just have them focus on it, and just as it gets closer. So just notice that the eyes start to cross, and so they stay and they accommodate to that moving object. Also, I'm just gonna inspect and look at the sclera, just make sure that it's white, that it's shiny. Just want to make note if it's any different color, like if it's like reddish or pink. Especially also note if it's yellow, that can be a sign of jaundice. Then just want to pull the eyelids down, look at the conjunctiva. Just want to make sure it's nice and pink. And I won't hurt you, but I just want to, you can just do the same on the upper eyelids. And then just using your pen light, just kind of make sure that everything is equal and round. Just want to notice if there's any irregular shapes. And then moving on to the nose, just want to inspect the nose, make sure that it doesn't have any, it's midline, doesn't have any deviations in the cartilage. Also note if the septum is midline, there's not any deviations in the septum. You can use your pen light and just kind of inspect the inside of the nose, note if there's any redness, any crustiness or blood. Okay, and then just have them close one nostril and just breathe in and out. So that's patent. And then just close off the other one. Alright, those are patent. And then I'm going to test the olfactory nerve, so just have them close their eyes. I'm going to have them smell something. See if they can identify it.
It's rubbing alcohol.
So, it's just an alcohol swab. Sorry. You got a little too close.
It's fine.
Alright, oh, I did also forget to mention, like once you've done the exterior parts of the eye, then you can just use your ophthalmoscope just to look at the inner parts of the eye. While you're also on the face, just want to test the cranial nerve of so touching their forehead with a cotton ball. So just every time you touch with it, just have them say when they feel it. Make sure their eyes are closed. So.
Feel it. Feel it. Feel it. Feel it.
So that was testing the trigeminal nerve. And then, so moving on down to the mouth. So you just want to use your pen light and just look at the buccal mucosa, look at the gums, their tongue. So you just want to inspect everything just to make sure that see if there's any colorations, any ulcerations, any bleeding, any crusting, any lesions. So this is kind of how these possible signs of cancer. Also, just take a look at the uvula and the tonsils in the back. Okay. And then to test this cranial nerve, you would just use a tongue depressor and have them say ah, and then just notice that if make sure that the uvula actually just rises up and stays midline, And then also you can use it to test their gag reflex, which I'm not gonna. I don't wanna make you. I know you're. I don't wanna make you vomit accidentally. All right. So going over to the ears now. Just turn your head. All right. So going over now to the ears. So you just want to inspect and palpate the auricle, the tragus, kind of, and then the lobes. So you just want to note like any discoloration in the ears, if there's any lumps, any masses or nodules. Just kind of use your pen light, look around at the inside of the ear, just note if there's any excess buildup of wax. And then you can test the vestibulocochlear nerve, cranial nerve, by having them close one ear and then whisper something into the open ear and have them repeat it.
I was doing the other ear. Apple banana.
What?
Is that what he said?
Yeah, I'll have to. Your left ear is your bad one, isn't it?
Mm-hmm.
Alright, fine. Alright, so close that ear.
Peanut butter.
And then once you've done the exterior, then you can just use your ophthalmoscope just to look at the inner part of the ear, look at the tympanic membrane, make sure that it's intact, that it don't have any ruptures, and also see if there's any buildup of wax in the inner part of the ear. Right, so moving kind of down a little, or also this time, so I'm gonna palpate kind of down behind the ears, the mastoid process, and then at the front part of the ear, like where the jaw meets, so it's the temporomandibular joint. So just kind of move your jaw up and down. You can feel it clicking. All right. Then so gonna feel for the temporal pulses. And then while also here, I'm gonna feel for the lymph nodes. So in the front of the ears, you have the preocular nodes. Behind the ears, the post-ocular nodes. A little bit further back, the occipital nodes, and moving under the jaws, the tonsillary nodes. A little further is so you got in the front you have the submental nodes, and then you have these submandibular nodes, kind of right between the tonsillary and the submental. I'm also around the side. I'm going to palpate the clavicle, or palpate the carotid arteries. But for these, you just want to do one at a time. Do not palpate both of them at the same time. And the right one's good. Also, just note, look for any jugular vein distension. See if that jugular vein is kind of a little sticking out a little bit. You can measure the jugular vein pressure. Also, just want to wear at the neck, denote any swelling. When you're looking at the thyroid, look to see if it's maybe there's a mass, like possible signs like of a goiter. And then you just want to palpate the neck overall, but be careful, don't want to palpate both the carotids together. And Also just want to note any tenderness. And then over here, kind of around the shoulder area, gonna test the accessory cranial nerve. So just have them kind of rotate their neck side to side. Okay, and then just put some resistance on their shoulders and just so raise your shoulders up. So able to do that. And then also also test the hypoglossal nerve, or still up on the face. So just stick your tongue out and just move it side to side. Okay, that's good. And then we'll test the facial nerve. So just frown, smile, just puff your cheeks out. Right, and then just close your eyes like really tightly. All right, so able to do all those. The vagus nerve is also intact just because been talking, not having their voice isn't hoarse. Been able to swallow, gag reflex is intact. Let's see. So moving on to let's do the upper extremities next. So moving on to the arm. So just want to again always be looking at skin just to note for any redness, any erythema, any rashes. Look for any lesions. Also could look for any scars. If they had if it's a patient, maybe you got transferred if they have any IVs, just look for any IV sites to make sure that they're intact and that they're not red or look irritated. You could check the range of motion of the shoulder, just have them kind of just rotate their shoulder. Have them check the range of motion of their elbow, just make sure they can bend their elbow. Check the range of motion of the wrist. And just do spirit fingers, check the range of motion of their fingers. Gonna palpate in the kind of here in the bend of the elbow for the brachial artery. And then use the palpate for radial pulse. And then just down on the other side, just on the inner side, palpate for the ulnar pulse. Note any swelling also that's going on, any masses or any nodules. Okay, and then usually repeat the same process for the other arm. So then moving on to the chest. So when it comes to the chest, you just want to first note the anterior posterior ratio compared to the transverse. Right? So just notice it should be a 2-to-1 ratio. If it's any greater than that, then people would call barrel chested. So just want to make sure that. So you just want to normally there would be you'd be able to see everything they'd be in a gown. You also have privacy, but you just would want to inspect the chest, note if they have any port, if they have any kind of central line. Just make sure that if they do, that it's check to see that it's not red and irritated or has any signs of infection. You first would inspect and then palpate the chest for any swelling, any masses. Make note of that they have equal sensation on all sides, that they're not maybe loss of sensation on one side. Then you would palpate. Then you would percuss the intercostal space in between the ribs. and then using your hands and kind of like a V, you would put it kind of in the where the ribs, where they make like a V, and then just have the patient inhale and exhale. So just looking to make sure that there's equal chest move or equal chest rise on expansion. So, and then I've got my stethoscope. So first we'll do heart sounds. So you go down the sternum, then go to the find the second intercostal space, right sternal border. So you would oscillate there first for. So this is your aortic. This is the aortic valve. So second intercostal space on the left sternal border is the pulmonary. Then you move down to the third intercostal space, left border or left sternal border is the tricuspid valve. Move down to the fourth intercostal space. The left sternal border is Erb's point. And then fifth intercostal space, mid clavicular on the left is the apical point of the heart. So that's the maximal point. So then you can get a pulse deficit by just getting do the apical or get a heart rate at the apex for 1 minute, and then get a radial pulse for 1 minute, and then the difference between those is the pulse deficit. So once you've got those, then now we'll listen for lung sounds. So just want to start in the upper right. So I just have them breathe in deep, and just every time they breathe, just move over to the opposite side, and just go down. So just want to be listening for any advent or any abnormal breath sounds like crackles, growls, especially magnotta stridor, although that was usually pretty easy to hear without a stethoscope. And then if you just want to kind of sit your back to me. So now I'm going to do the posterior side of the chest. So looking at the posterior side of the chest, just want to again be noting skin, just looking for any red spots, inspect for any nodules, any masses. Also just palpate for any masses or nodules that might be deep. You want to palpate the back, feeling for any tender spots. Also notice any spots with absent sensation. Right, and then you just want to percuss in the intercostal spaces, just kind of going down and across. And then you want to find the T9 and T10 vertebrae, and then just kind of like you did in the front, just like put your thumbs on the T9 and T10, and then just have the patient inhale, and just notice your thumb, making sure that your thumbs are moving like equally, so that there means that there's equal chest expansion. And then once you've done that, then you should use your stethoscope, and then just kind of starting up right below, kind of like above the scapula. Just want to check for breath sounds. So it's kind of up at the top of the lungs. So let's have them inhale and exhale. You're wanting to make sure that you do not do it directly over the scapulas. So you won't really hear much anything over those. Alright. So you just want to turn it back here toward you can turn it back towards me. Alright, so moving down to moving down to the abdomen. So when it comes to the abdomen, you want to make sure that you inspect and then auscultate first before doing palpation, because palpation can sometimes can cause like there to be alterations in the abdominal. So first, just I would inspect the abdomen, look at the contour of it, like look and note if there's any bruising or any colors. You know, maybe ask them if they use any, like if they're diabetic and have any insulin shots they give regularly or Lovenox shots, just to see if there's maybe note any blemishes. Sorry. So look at the umbilicus. Just note the location of it. If there's any discoloration around it. So before you do any palpation, you just want to listen for any bowel sounds. So always start in the lower right corner. So on the right lower corner. So you should hear probably at least 5 to 30 breath or bowel sounds. So if you hear any less than that, then then you say it's like hypoactive. If you hear more than 30, it's got a hyperactive area. So then you, after listen for a minute, you just then move up to upper right quadrant. You move over to the left upper quadrant. And after you listen to that, then you move to the left lower quadrant. So also make note of like the intensity of the bowel sounds, and also just like kind of what the pitch of the bowel sounds are. So once you've got those, then it's okay to palpate. So I'd first want to do light palpation, just kind of press gently. So start in the lower right, so just noting any guarding or tenderness, like how rigid is it, if there's any swell or any masses, any nodules. Okay, so after that, then you move on and do deep palpations. This is where you press a little bit harder. And also you could ask the patient, like if they've had any problems like with having bowel movements. You could ask them when their last bowel movement was, like what kind of consistency they've been having. Is their bowel, is it loose, or is it more, are they well formed? Also could ask them if they've been having any difficulty urinating. Does it hurt when they urinate? Also ask them if they've been having any blood in their stool, like or are they dark or tarry looking? So then moving on to the lower extremities. Again, want to note the skin, look for any redness, especially when I look on the knees. Notice if there's any swelling of the knees. Are they red? Are they ask them about any kind of like problem, any like knee pain they may have had, if they had any masses or nodules like in their knees. Also note also look at like their feet, especially the bottom of the feet with patients who are diabetic. Diabetic patients tend to have more problems with their leg or their feet just because they don't have as good a feeling in their feet. So I want to make sure that there's not any cuts or scrapes on the bottom of their feet. Also meant to mention, don't make me think. When I was looking at the fingers, you also want to look at their fingernails. Want to look at their toenails also, but look at the fingernails. Note if there's any clubbing. You can also just squeeze the finger and then let go, just checking their capillary refill. You also just do the same on the toe. So just squeeze one of their toes and then let go to check the capillary refill on their toes. And then I've already seen where they've already flexed their knee, so have good range of motion of their knee. You saw them walk, then you saw that you can kind of saw their range of motion of their legs. And curling your toes, so have good range of motion on the toes. Want to look at the hair on their legs. Hair on their legs could be an indication of like how good their blood flow is. If there's not very much, if they don't have very much hair on their legs, that could be maybe a sign of peripheral vascular disease, and just mean that they don't have as good a blood flow to their legs as they should. So in female patients, you also want to also while you're looking at the chest, you also just want to do a breast exam. So just want to inspect and look at the areolas, their nipples, like look at the kind of the size, the location, the shape. You just want to palpate the breasts for just feeling if there's any masses or lumps. Then maybe you can also just teach the patient like how to kind of do like a self-breast exam to see if they have, when they're at home, just to check for potential lumps that they maybe need to consider like going and seeing a doctor about, or like having a mammogram. So male patients also, just breast exam, just kind of note like the location, the size of their nipples. Have them also just palpate around the nipples palpate for any masses, any nodules, or any swelling. So then for female genitalia, you want to put them in it's like the lithotomy or lithotripsy. You want to have them lay down with their feet like kind of angled up, so you can do an inspection. So just make sure your gloves or just everything is where your instrument, if you're using an instrument, make sure it's properly lubed. So you just want to inspect the mons pubis, like just see about any hair distribution, look for any infestation. Look at the labia majora, labia minora. And then also just inspect, I think it's Bartharian or Barthian. There's like these two little like areas like on the sides. They can some patients might have a history of them swelling. So if they don't have a history of swelling, or if they're not currently swollen, then it's not going to be an issue. But if they complain of the history of those areas being swollen, examine that. So you want to inspect the vaginal opening, noting like just the kind of angle it's at, and note the size. So, and with properly lubed gloves, you just want to inspect and palpate the cervix, and you want to inspect and palpate the just the urethromeatus, the clitoris. Just want to note for any any swelling or any tenderness. And then for male genitalia, you just have them kind of sit like on the end of a chair or a stool, facing you. You just want to first look at the base of the penis. Just look and see if the hair distribution there. Look for any infestation. Then just moving out, we're looking at the shaft. Just be looking at the skin. Look for any lesions. Sorry. Just look for any lesions. Look for any discoloration, like any erythema or excoriation. Note like if they still have foreskin. If they do, just note. Make sure just kind of look to see how the cleanliness of it. Make sure that they're doing proper hygiene care for that. Look at the glands to see if it's red, swollen, and then you can kind of just palpate the glands, like kind of just to note if there's any discharge. Also, for a female breast exam, you can palpate when you're palpating the breast. You can also note if there's any discharge from the breasts. Right. And then for male genitalia, you can just inspect the scrotum, noting any, like the skin, just make sure it's intact and has good integrity. Note any discoloration or any excoriation from it, possibly from like if they're, I don't know, older patients might like if they're if they sit or if they've been like maybe sitting in stool for too long. You can do a scrotal palpation. Just kind of use the thumb and 2 fingers for the palpate the epididymis and the testes. Then you can use a pen light and just use transillumination just to see the inner parts of the scrotum. You can just look and see if there's any masses or any swelling going on in there. And then you should also educate the patient on how to do a self-exam for just to feel to do that palpation themselves at home, just so they can just maybe see early signs of testicular cancer, and if they need to have anything looked at. And then the last part is to just look at the perineal area or the perianal area. So just inspect and looked at the anus, just noting any swelling, or you can look at the sacrococcal area. Notice if there's any like bulging, or also just notice if there's any redness. Maybe I can see if they have some skin breakdown. Kind of a little bit above that, you can look at the sacral area just for patients who are bed bound, and notice if they maybe have any pressure sores developing. For male patients, you can palpate the prostate, just noting like the size of it, the shape, and just like if it's like enlarged or swollen. And then also can inspect and palpate the rectum, just palpate the peritoneal cavity. And then if the patient complains about like the dark stools or any blood, you can of course always just do a occult stool test to test their sample for blood. And it also would palpate the anus, just to note like their sphincter tone. I believe that is everything.